What's going on, everyone? I'm just a typical, average American here today to react and learn about what healthcare is like in other countries around the world. Because, to be honest, here in the United States, we've just all kind of accepted our weird healthcare system here. And, it's based on insurance and getting huge hospital bills that nobody can afford. And we've got deductibles and copays. And you don't even know if your healthcare insurance is going to be accepted by a particular hospital. And all this crazy stuff, really, when you think about it. But although there are a lot of Americans like myself who think that our healthcare system isn't very good, we're not that happy with it. It kind of works, I guess. It functions, and I think it's just what we're used to, Here in the United States, it's just normal. So I don't really see it changing anytime soon, unfortunately. But I know in other countries outside of the United States, you guys have very different healthcare systems, right? And perhaps better systems of healthcare based on some of the things that I've heard. So today, I want to take a look at this video and learn about what healthcare systems are like in other parts of the world, and maybe learn about some of the healthcare policies that are better than the United States. So let's take a look.
The United States has long had one of the worst balances between what healthcare costs each citizen and what benefit they get out of it.
Oh my God, really? Because I thought, as bad as our system is, and by bad, I really mean the American healthcare system is extremely expensive and very needlessly complicated. It's very convoluted, it's very confusing and expensive. The actual care, the doctor, the treatment, the medicine, the surgeries, those are all very good, actually. I think here in America, if you can afford it, if you can actually pay, you can get really, really, really great medical care. That's like one good thing about the United States, but unfortunately, getting the care is difficult and stressful and financially, impossible for a lot of people. So that's the crazy part. But according to this, it's already saying America, you don't even get that good of treatment based on what you pay, which is disturbing.
In the rest of the world, citizens pay much less or nothing and often receive higher quality of care with higher life expectancy and lower rates of disease.
What? What? Oh no. I mean, that's good for you guys. Oh no, for the United States. Per capita health spending, almost 10,000. I guess that's per year for an American. I mean, because a lot of Americans, if you don't know exactly how our healthcare system works, you need to fundamentally, first and foremost, you need healthcare insurance. Most Americans get that through our jobs, through our employer. They provide healthcare as a benefit for working. Like if you work at a certain company or McDonald's or whatever, they are going to provide you with a healthcare plan as a part of working there. And that's a huge, huge factor for being employed in the United States. You're going to get healthcare insurance. Otherwise, you have to pay the government for like a private healthcare plan. You have to pay them every month. I mean, even if you get health care from your employer, some of the money to pay for that comes out of your paycheck anyway, but it's more affordable for most Americans, if that makes any sense. I don't know if that even makes sense to people because it's so like weird and convoluted, but you need healthcare insurance because if you go to the hospital, instead of having a $50,000 bill, you're only going to have like a $1,000 bill. Or so anyway, that's why Americans can spend up to like $10,000 at a hospital per year. And it sounds like in Japan it's a third of that. The United Kingdom only 3,000. Greece is less. Panama is less. Obviously, you can see from this data, the United States, we have to spend the most on healthcare every year per capita. This is actually not that shocking to me. Well, I'm actually kind of shocked, like, I knew other countries spend less. I didn't just realize how much less. And I mean, there's other countries where the healthcare is free, right? I mean, I can't even imagine that.
So we wanted to know which countries and territories get the most out of their healthcare. Well,
Right.
since 2012, the Bloomberg Healthcare Efficiency Index has measured exactly this balance. As of 2016, one of the top 3 ranking countries or territories was Spain. Spain is an
Oh.
above average representation of healthcare in OECD countries.
This is really interesting. I don't know anything about Spain. I didn't know that they had like some of the highest rated healthcare system in the world. I didn't know. I really want to know what exactly they're doing.
And spends roughly $2,600 per person, with an average life expectancy of nearly 84 years. About
Wow. 84 years. That's amazing. I mean, Americans have a lower life expectancy for a lot of different reasons. Access to healthcare is one, but also like our processed food, right? Like our eating habits, how unhealthy Americans are. So I'm not shocked by that, but so Spain is like very, very healthy and has great healthcare.
10% of the country's GDP goes towards healthcare costs, which are largely subsidized by the government. This system of socialized medicine is globally known as single payer, and most citizens see no out-of-pocket expenses when they visit public hospitals.
Oh my God. Single payer. The healthcare is funded by taxes. Oh, I would love that. When I tell you, I think most Americans would love this. I don't know why, but healthcare, it's not really a huge topic of discussion or debate in America. It is from time to time. People talk about it, people complain about it, but like it's not as talked about as you would think for how difficult it is for a lot of Americans. It's kind of shocking. And I think a lot of Americans would love the idea of our taxes paying for our health care. I don't know what most of my taxes are even going towards. Like our American military, or like I don't know, maybe like building a new road or something. But if I knew my taxes were paying for healthcare for me and for everybody, that'd be wonderful. I would love that. I'd be happy to pay taxes. Because man, it's such a simple idea too. It's not even that complicated. And then you just pay your taxes, pay for it, and then you just go in and get medical treatment when you need it. And they don't mail you a bill later. Is that right? Because the most stressful part in America, if you go to the emergency room or like I've gone to the emergency room and then like a week or two later in the mail, you get a bill and you're waiting for that bill to come. You're stressed out, you're nervous, and you open up the letter and it's like $1,000. That's why a lot of Americans don't even go to the emergency room. Like seriously, it's bad. Like trying to come up with $1,000, like most people can't just do that. It's bad. But so it's really, if you're wealthy or rich in America, you're actually pretty happy because it's good care. Like when I went to the emergency room, they were fantastic. Um, it's just your healthcare insurance pays for most of it, thank goodness, but you still get charged like hundreds or $1,000, or if you broke your arm, I don't even know. It'd probably be like $5,000. I don't even know.
In fact, the right to health care is guaranteed in Spain's constitution. However, this system also leads to
Wait, what did? Hold on. We can't skip over that. Healthcare is recognized in Spain's constitution?
Spain's constitution.
I have never heard of that before. So healthcare is a right in Spain. This is so interesting. Why isn't healthcare in our constitution? No one ever talks about that. Because a lot of Americans are very, very proud of our constitution. I don't think there's anything about healthcare. You would think like one of the main purposes of forming a government is to provide a service like healthcare to its people. You would think that. Wow.
However, this system also leads to complaints about delays in seeing doctors beyond primary care or getting specialized surgeries.
Oh, I see. So if everybody can go get medical care, you don't have to worry about paying. A lot more people are going to go, which is good. Like that's what you want. You want everyone who needs help to go get help. But I guess that causes a big stress on the healthcare system. Doctors have longer waiting lists, and they're saying it's harder to see specialists. So it's really, again, in America, you don't have to wait very long to see your doctor, or schedule a surgery. It's pretty quick. That's a nice thing. But again, you have to be able to pay for it. Like, if you have money, America is a pretty good place to, like, a good healthcare system for you. But it's just a horrible sentiment to say, screw all the poor people. They don't deserve healthcare. That's so horrible. But I see now that it's a balance because, like, in America, you can see doctors very quickly, but it's way too expensive. And in Spain, it's free, but it's really, you pay taxes to cover it, and you have a longer wait time to get healthcare because a lot more people are using it. And it's tough to say what the perfect balance is.
Ranking second on the efficiency index is another country with universal health care, Singapore.
Oh, Singapore. I don't know anything about Singapore. Apparently, they have very, very, very good healthcare too. And we're really talking about healthcare efficiency, which I think I understand what they mean by efficiency. The healthcare has to be good, has to be affordable, and it has to be accessible. Like, you have to be able to see your doctor and get treatment before you die of something. I'm kind of exaggerating, but if you have cancer or something and you need treatment, it doesn't, you can't afford to wait. So that can be scary.
Unlike Spain, Singapore requires that care is never provided for free in order to avoid wasteful use of the system.
What now? This is so fascinating. So in Singapore, they purposefully make you pay so that there's a little bit of a barrier to entry to reduce waiting time. This is a very interesting solution to the problem that we're kind of discussing of having access but not waiting too long.
Instead, healthcare costs are kept artificially low through government subsidies, which compared to Spain use only 1.6% of Singapore's GDP.
I like this. I didn't know about this 2 minutes ago. Singapore. So it's not free. but it's very, very cheap. So there's a little bit of a barrier to entry. So you only go in if you really genuinely need care, and basically everybody can afford it, but it's not like it's not like free. You're not just going to walk in for no reason, or for a very, very minor problem. So it's going to reduce the waiting times. That's a very interesting solution. Maybe that's like the way to do it. I don't know. That's really interesting.
In addition to implementing price controls on medical care and medication, the country uses a system known as Medisave. This is a medical savings account where up to 9% of employees' salaries are required to be deducted and set aside, and they can be used for personal or family care. This
Whoa.
combination means that costs are low, while the quality of care is one of the highest in the world.
I like this a lot. This Singapore healthcare system, I like it. I like the healthcare systems that are paid for by taxes as well. Although that sounds like it creates a lot of people going in and big wait times, because it's free. This is very similar, but there's a little cost. The government controls it and keeps it low, and the government in Singapore clearly cares a lot about healthcare because they even mandate that you set aside money from your job for healthcare. Like you have to do that, which is interesting.
But overall, the best and most efficient healthcare system is reportedly in the autonomous territory of Hong Kong.
Hong Kong, in China. I don't know anything about Chinese healthcare.
Interestingly, the territory uses a combination of private and public care, with one of the highest life expectancies in the world, costing just $2,000 per citizen and comprising just 3% of the GDP.
Wow.
However, Hong Kong's high-ranking healthcare may not be exactly what it seems at first glance. While public healthcare plans can be purchased at low cost, the wait to see specialists or get certain surgeries can be excessive.
So why is this considered so highly rated if you have to pay and there's really long wait time to see specialists? Why is this considered so good? Because Chinese population is so healthy and lives so long? Like the care is amazing?
On the other hand, private hospitals are reportedly speedy but very expensive.
Oh, they have public healthcare where anybody can go and get healthcare services for a low cost. Or you have the option to go to a private private hospital or something. And if you want to pay more money, you can get seen quicker. So having both options, that's actually nice. That's actually smart. So, because that's what, like, in America, it feels like everything is privately owned. Every hospital is trying to make money. In America, every hospital is trying to charge you as much as possible and make as much money as possible. And that's a very scary thought, that healthcare is like a business in America. You know, it's not like buying a loaf of bread or cereal or something. You can choose if you want to do that or not. Healthcare, you need healthcare. You know, it's not a choice. When you need it, or you'll die, or, you know, it'll be bad. So the idea that it's like controlled by a business, that's really scary. Because you have to pay whatever they ask. You can't not, you have to pay, or like it's your life. So that's scary. So that's what it feels like in America. If you have good healthcare insurance, you feel decent about it, I'll say. Like your life won't be ruined. But these different systems, like especially in Hong Kong, having both options, private and public, that's interesting. I like that.
This combination of low-cost care for routine visits and medication with high-priced elective or specialized care makes Hong Kong's system incredibly efficient and difficult to overburden, thereby avoiding raising costs for everyone.
Wow.
While these three get the most bang for their buck with very high standards of care and life expectancy, they're also difficult to apply broadly around the world. Singapore and Hong Kong have populations of under 10 million people, meaning that most health factors are uniform throughout the region and population. By comparison, the United States is enormous, with a population of over 320 million, making centralized or single-payer healthcare more difficult to implement without serious complications.
I see. That okay, maybe there's some excuses for our healthcare system, but to be honest, like I think healthcare is so important that if the United States really wanted to change, we could. Like we could do it if we really wanted to. We just don't want to. There's too many companies making too much money, but yeah, this was really eye-opening. There's a lot of great systems of healthcare that are way more affordable and just as good out there in the world that Americans really need to learn about. Like we need to be talking about this, and so I'm really glad I learned about this. Anyway, if you enjoyed this, feel free to give this video a like or leave comments with your thoughts on any of these healthcare systems or wherever you live, what your healthcare system is, and if you like it or if you think it's better or worse than others or America's, or that'd be cool to hear about. And if you're interested in more videos like this, feel free to subscribe for more. And until then, thanks for watching and see you next time.